Hi, welcome to another video of the pain series. In this video, we are going to talk about the belief system and the pain. My name is Nikhil. I am the head of physiotherapy and an advanced neuro rehab specialist at PRS Neurosciences. So,
1, 2, 3, 4.
what is a belief system? And if you, for example, if you think that with this specific injury you will have more pain, you will start getting more pain. It's a self-fulfilling prophecy. You anticipate more pain, you get more pain. You anticipate less pain, you get less pain. This is primarily in people with chronic pains. So I will start this with a story. One patient was referred to me. Patient is in his late 30s, maybe 38, 39, and he had some back pain for quite some time. So he went and met a doctor, and doctor did the primary examination and asked to get an MRI. So after that MRI, the MRI report, it showed a couple of disc prolapses, small disc prolapses at multiple levels, L2, L3, L3, L4, some multiple levels. So when the disc prolapse happens, what's the first thing any doctor will say? Doctor will say, don't bend because the disc will come out. And he did not, he is a very careful guy, so he did not bend his back in the first day, second day, third day, and so on and so forth. And he was given with some relative rest, he was given with some pain medications. With all this, his pain has reduced. And he was referred for some physiotherapy session. And that therapist also told, don't bend, don't ever bend your back because the disc will come out. So what happened? He was having a belief that if I bend, my back pain will increase. This gets reinforced with the therapist command saying that don't bend. If you want to pick up something, you squat and pick up, correct? So with this, again the pain got better. So what happened? His belief system got stronger. I did not bend, so my pain got better. And this is not one day, not 2 days. Once the pain stops, we need to re-establish normal movements. Our back, our spine is designed for bending, for jumping, for different activities. At some point of time, you need to re-establish, restart these things. Unfortunately, the patient did not follow up with the therapist, patient did not follow up with the doctor until they say that now you can bend. This never happened. Every time what happened? You go to a doctor, you go to a therapist, don't bend. So this has become his belief system. And each time he gets better, his belief system started getting more and more and more and more reinforced. Now, after some days, after 6 months or 7 months, one fine day he had to bend and pick up something. He had no choice, so he just bent and picked it up. Suddenly what happened? He started getting a pain. This pain is not because of the disc, because he did not use that structure for last 6 months. He did not do any activity, so automatically the muscles will go for weakness. So because of that weakness, now he developed the back pain. But now what happened? Again his belief system got reinforced. Until or unless I was not bending the back, I was okay. One day I bent, I got the pain. And after that, for the next 2 years, he never bent his back. All the time he keeps his spine straight, like a robot he walks around. If you want to pick up something, he squats and pick it up, but he never bent the back. But the question is, how long can you do it? Our body is designed to do various type of movements. That's why you have different ligaments, muscles, joints, isn't it? So when this patient referred to me, the patient had back pain that did not go away, and patient never bent his back for last 2 years. Now as a clinician, I am in double trouble. I need to put on some exercises, but his muscles are very weak because of his belief system. He believed it is risky, and every time they go to a medical help, they reinforce this belief. Every time he does some activities, that reinforce his belief. So like this, the belief system can fundamentally affect your body structure and the function. When I say function, pain is also included in this. So people, this is one aspect of the belief system and the pain. Second aspect, if you anticipate pain, you will have more pain. If you anticipate less pain, you will have less pain, because like I told in one of my other videos, it's not a plain wire connection. The brain is processing the pain a lot. The brain is, in the brain, these fibers are connected in a very unique way. So your belief systems, your thought processes, your cognitive skills can alter the way the pain is being processed in the brain. It's not that the stimuli is different. It's not that the stimuli is less intense or more intense. It's more about how it is processed in the brain. So when your cognitive style is positive, when your cognitive, when you are in a good mood, usually pain will be less, because you are not anticipating pain at that instance. Whereas you feel dull, you feel isolated, you are anticipating more pain, you are expecting more pain. So because of the complex networking of the brain, this intensity of the pain can increase or decrease with what you think, what you believe. If you think a treatment is going to be useful, a pain treatment is going to be useful, you have to believe it is going to be useful. You go to the best doctor, you go to the best therapist for the management, but if you don't have the trust that this is going to get better, just coming out from a pain, especially in a chronic pain, is going to be very difficult. So the take home message is your belief system or your anticipation, your expectation will alter your outcomes. So this is one more reason, especially if you are suffering from any kind of pain, let it be an acute or chronic pain, staying positive, being positive is a crucial step for your pain recovery. If you have any more doubts, if you are suffering from a chronic pain and you don't know how is your belief system making your pain worse, do come and visit us. We have our expert team. They will evaluate your pain and give you the right directions to come out of this pain. Thank you.